Jonathan Metzl. He is a professor and director of the Center for Medicine, Health, and Society at Vanderbilt University. That's going to be relevant to our discussion. He's also the author of Dying of Whiteness. That's also going to be relevant to our conversation. So, Jonathan, welcome back.
Great to be back.
All right. So, during coronavirus, we've had a number of issues. One is the government's reaction, which has been abysmal. And the other is how, unfortunately, the disease has affected minority communities so much more. And you pretty much draw a correlation, not a correlation, but a connection there. So let's talk about that. So do you think the government's reaction, let's start with the simple part, has hurt Blacks and Latinos in the country more?
Top to bottom, yes. If you're talking about the federal government, absolutely. There were multiple times throughout this pandemic, and particularly in the beginning, when it became clear that, at least in the early stages of the pandemic, and through now, that minoritized communities in this country were going to be at higher risk. There were multiple times from the very beginning where the government could have said, we're going to protect everyone, including the people who are the most vulnerable. So in the beginning of the pandemic, that could have meant being much faster about releasing data that showed that Black and brown communities were at higher risk and getting sick and dying more, all the way to decisions not to expand the Affordable Care Act and expand Medicaid expansion in particular in 14 states that would have protected a lot of minority communities, to everything that's happening now where the government is basically deploying troops for protests and not deploying troops to help with the pandemic, and mass produce PPEs and all these things. So top to bottom, I would say it's been a real missed opportunity, and people are suffering and dying as a result.
So in the past on the show, we've talked about why coronavirus is affecting Blacks and Latinos more in this country, including one of the big factors, not the only factor, is that they have more of the essential jobs. And so a huge percentage of coronavirus cases in California are Latinos. And so is that part of the reason that you think Donald Trump has taken this less seriously? That if it had hit Mar-a-Lago harder, that he would have taken it more seriously?
Well, I think that was the narrative in the beginning. In the beginning, it kind of seemed like this is a Black and brown thing, and it was not for any genetic or biological reason. It was because, as you say, minoritized communities often have jobs that put them in the path of the virus, or they don't have health insurance, they don't have access to democratized health information or PPEs or all these other factors. And so I think he was able to spin it that way in the beginning. And that led to a bunch of different things. Certainly, it led to a lot of white people thinking, well, this isn't going to affect us. And so this resistance to masks came out of that. And it also led to the refusal, I think, really another catastrophic error, to demand building up health infrastructure. In other words, if you're in a pandemic, you want to build the institutions that are going to help the most people, like health insurance, for example, or hospitals or PPE manufacturing. So the fact that this was able to be spun as it's just a Black and brown thing, I think created this kind of laissez-faire attitude among particular white populations, which in part is why we're in this predicament right now.
Yeah, and obviously ignorance is a huge part of it, and the Republican Party is more ignorant. They don't believe in science and as much as Democrats do. It's just reality. So now, in terms of the policy actions that Trump has taken, that's interesting as well. You wrote about how their efforts to kill the Affordable Care Act in the courts could be obviously supernova relevant in the middle of this pandemic.
Well, I think, if there's a pandemic, there are two things you want. You want people to have access to health care, health insurance, and not worry about, am I going to go broke if I go to the doctor? Because when people start to get sick, you want them to have access to this information. You don't want them to have to keep going to work sick and spreading the virus and factors like that. And then also in this country, we have health insurance that's linked to your employer. So when people start losing their jobs, you want to have some kind of safety net so people aren't going to go bankrupt. And in the beginning of the pandemic, in March, when this really started to hit, there was a tool that the government had, which was, again, the Affordable Care Act, which, it certainly has had its problems, but it is a national health program. And it is a national health program that should have been expanded in the beginning of the pandemic to protect people. Red states should have expanded Medicaid. And an important thing about the Affordable Care Act also is that even though the Affordable Care Act has had some mixed results in some areas, it was highly effective at closing the racial health gaps in health insurance, particularly in blue states. For example, when the Affordable Care Act was first brought into being, 33% of Latino populations didn't have health insurance, and that number dropped to about 18%. 25% of African American populations didn't have health insurance, and that number fell precipitously as well. So here was a chance to build on those and give people, including Black and brown people, health insurance. And instead, during a pandemic, the Trump administration has done exactly the opposite. They've doubled down by making statements that they want to kill the Affordable Care Act with no backup plan. And they're supporting this ludicrous case that's going to be in front of the Supreme Court in the fall, which is from California and Texas, to kill the whole thing with no backup plan. So it is really catastrophic. It would bring these gains in health insurance to a halt and reverse them. And it would disproportionately affect poor people, including poor white people, but also poor Black and brown people.
So, Jonathan, what do you think would happen if the court struck down the Affordable Care Act? So let's say that in October they say, okay, it's gone. What happens?
Well, we know. I mean, that was the data I looked at in my book, Dying of Whiteness. More people would die. More people would. I don't mean to laugh. It's so obvious that's what the data shows is that people would not be able to access healthcare. People would not be able to pay for medications. There's no mystery about this. So I think what would happen, especially because from the beginning, Trump has said, I want to kill the Affordable Care Act. But, where's the beef? What's the backup plan there? There isn't one. And so I think what you would see is dramatic rises in uninsurance, dramatic rises in medical bankruptcy, dramatic rises in people not going to the doctor when they're sick. So it would be terrible from a pandemic standpoint. It would be terrible from a financial standpoint. And as data from my book, Dying of Whiteness, shows, it would also lead to more illness, more death, shorter life expectancy. And again, I just can't even begin to tell you how unambiguous that data is. But the minute you start cutting people off the rolls, they stop going to the doctor, health insurance becomes more expensive, more funds go to emergency rooms and less to the system. And ultimately what you see is falls in life expectancy, particularly for low-income people of all races.
Jonathan, what do you think is the main driver of that for the Republicans? So in the beginning, they didn't want the Affordable Care Act because they were being paid by the drug companies, the insurance companies, et cetera, and they're just serving their donors, as they always do. But now those companies have gotten used to this regimen, and it's not so bad for them. That was basically the deal that Obama cut. I'll let you keep robbing us blind as long as we cover more people. And so what's left other than stubbornness and we hate Obama? Why do they want to go after Affordable Care Act so bad?
Well, part of it is just plain old structural racism, as I show in my book. I do a lot of interviews, and this idea that there's a program that might help me, but it might help other people also. So part of it is they're playing to what they think is this racial assumption. And also, you can just see the war on blue cities right now that's happening. There's, Los Angeles is a great example, or New York City or Chicago. If they destroy the Affordable Care Act, the places that would get hurt the worst would be blue cities and states with large minority populations. And so it would continue this war on blue cities and states. The flip side, as I again showed in the book, is that a lot of poor white people would die also. But I think it continues this like Civil War 2.0 kind of thing. So it's an ideology more than it is a financial decision. So I think that's part of it. And again, just probably one of the worst possible statements you could make in a pandemic is to say certain citizens' lives matter and others don't. But that's what people are protesting about now, and so really that's the war is whose lives matter, and this Affordable Care Act unfortunately has become part of that bigger debate.
Yeah, and for Republicans, it's not just racism; it's also they're just not in it for poor people. So you're black, brown, white, they just don't care about you. Their donors are all incredibly wealthy, and that's the crowd they care about. Now, last thing, and it's really important, Jonathan, under your logic, is it an imperative that we pass Medicare for all? Because the folks who are hurt the most are poor, the middle class, et cetera, and under Medicare for all, they would all be covered.
I think we need a national something. For people who know my work know, and I just had a piece in U.S. News last week about this, I'm a big fan of the Affordable Care Act just because it seemed like a reasonable compromise between public and private interests. And I think the Affordable Care Act would have led to a national health care program. And the most important part about the Affordable Care Act is it's already the law. And so I'm a huge fan of Medicaid expansion everywhere, and I think it would have gotten us to the same place in a way, and it would have kept all the shareholders at the table. So we'll have to see honestly what happens. I mean, right now I'm not going to, and I should not make a hair joke, but I'm not going to split hairs about this. I would say that that really the issue is, we need some kind of national system, right? And what we call it is really immaterial at this point. We're facing, look at the death and devastation of this virus. And so, however we can get there the fastest, I think, is the better way. And you mentioned before, I think this is something that poor white people should be protesting for also. Either expand Medicaid, Medicare for all. We have to do something that's the opposite of what the Trump administration is suggesting.
Yeah. And so, look, we beat up on Trump and he more than deserves it, and the Republican Party. But let's not forget that the corruption of the Democratic Party, too, because there's no reason we shouldn't have some sort of national system, single payer, Medicare for all, whatever it is. And people are dying and they know it. But they also get donor money from insurance companies and drug companies. And that's why we don't have it. And a lot more Americans die, especially in the middle of this pandemic. All right. Jonathan Metzl, speaking truth to power. Appreciate it. Thank you for joining us. It was great to have you.
Likewise. Let's keep talking.
On the go? Don't worry, we got you covered. You can still listen to TYT at our new podcast network. Find us on Apple Podcasts, the Google Play Store, or at tyt.com/podcast.